Hello, my name is Latisha Wilson, and I am doing a video presentation to answer questions on the topic of diversity and its importance to those working with families in the field of marriage and family therapy. This assignment is for a class that I am taking at Texas A&M University, Central Texas. And I'm ready for the first question.
What are your views regarding the importance of marriage and family therapists having a sensitivity to family diversity issues?
Well, when providing mental health services to individuals, couples, and families of diverse backgrounds, mental health counselors should consider the impact that diversity sensitivity has on the quality of the services rendered. I feel that as a marriage and family therapist, there will be a wide range of family dynamics and systems in which you will deal with, and as a result of this, the various diversity issues that will be present will be immeasurable. With this in mind, marriage and family therapists must be aware of these diversities and be sensitive to them as they are unique to the client to avoid doing unnecessary harm to the clients. Ultimately, marriage and family therapists are in a position to affect a person's life, and a lack of sensitivity to issues unique to their clients can cause hurt, mistrust, anger, discourse, and other harmful results.
Why do you think this is so important?
Sensitivity to diversity by MFTs, or marriage and family therapists, is important because of the significant impact on the effectiveness of counseling with couples and families, and on the quality of service that counselors offer them. The impact that diversity has on couples and families becomes evident in how counselors are able to appropriately perceive those relationships within their specific context. Seeing those relationships within the context of their specific diversity allows therapists to recognize the strong influence that it has on them as individuals, as well as on their relationships with one another. Couples and families live within societies where their gender identity and expression, sexual orientation, race, ethnicity, religion, among other diverse factors, influence their worldview. Ignoring this would amount to ineffective interventions and unethical counselings. Diversity also has a direct impact on counselors because it necessitates that they increase their attention to contextual issues in their practice directly related to many different diversity factors. For example, counselors must pay attention to power differences between the sexes and cultures, as well as in spirituality and religion. They must also remain crystal clear about their ethical duty to remain non-judgmental towards non-traditional couples and families that include sexual and gender minorities. Therapists view these issues as meta frameworks, which unifies gender, culture, and other diversity factors.
Can you describe a worst case scenario when therapists are not trained to be understanding and sensitive to family diversity?
Well, it must be reiterated that marriage and family therapists must be able to address diversity in their practices when providing services to couples and families. Contextual issues have an impact in the lives of individuals in negative and positive ways. It is important that counselors address diversity issues in their practice, and that they recognize that ignoring these components is unethical as mental health professionals. Thus, the need to be trained, aware, and confident enough to deal with these issues as they arise. A worst case scenario that could result from a lack of training on the part of the therapist is if you have an African American couple who states that they believe in and do impose corporal punishment upon their children. It is not in an abusive manner, but this is a culturally dominant form of discipline within the midst of many Southern families, especially within the African American community. But due to a lack of sensitivity to cultural diversities, the therapist may belittle the couple's choice and call CPS, starting an undue case of child abuse allegations against them. Another instance would be a situation in which a clinician poorly trained to work with diverse families would insult them for this same family for instilling in their child to be cautious when dealing with law enforcement or in a predominantly white area. What the clinician is not sensitive to is the historical presence of racism against African Americans, especially the young males. Also, in recent times, the brutality that has transpired between police and African Americans, both male and female. As a result of this, the clinician imposing that the need to be cautious was unwarranted. The young man or son in the family got into an altercation where he spoke back to an officer, questioning him about being unlawfully detained, and ends up shot and killed. I would think that this is definitely a worst case scenario, and the insensitive clinician could be held liable as well. It is no exaggeration to say that a culturally competent provider can mean the difference between a person making it or falling through the cracks. Here's another extreme example. Latina marriage and family therapist named Josie has a brother with schizophrenia who speaks only Spanish. When her brother failed to receive culturally competent care over a 20-year period, he was hospitalized over 100 times. When he finally did receive the culturally competent care, he was only hospitalized once in 15 years.
Can you identify action steps you will take to continue to, in your increased understanding and sensitivity to diversity issues related to families?
First and foremost, I will ensure that I am aware of any biases and misunderstandings I have through continued education and research. I will ensure that I remain abreast of current ethical dilemmas and diversity issues plaguing our societies. As best as I can, more specifically, I will ensure I do due diligence when I have a family who has cultural differences from that of myself. In the book, Healing into Action, the authors Sherry Brown and George Mazza list principles that I feel when put into practice can definitely help me or other therapists create a favorable environment for building diverse communities and maintaining the sensitivity to such diversities in order to be effective. These are welcome everyone. In order for people to commit to working on diversity, every person needs to feel that they will be included and important. So I would work to ensure that I include every client to make sure that they are a part of the process of us growing and communicating with our diversities and the issues that may arise within counseling. And the second one would be guilt doesn't work in fostering diversity. A lot of times people think that blaming people as a way of motivating them will work, but it's actually not effective. Shaming people for being in a privileged position only causes people to feel bad. It doesn't empower them to take action to change. People are more likely to change when they are appreciated and liked, not condemned or guilt-tripped. Another one would be to learn to treat everyone the same. Well, actually, what I mean is treating everyone the same may unintentionally be oppressive. Although everyone is unique, some of us have been mistreated or oppressed because we are a member of a particular group, and this falls into the category of stereotyping. So I would need to take the steps in making sure that I know that every client is unique and individual, even within a family setting. Next, I would have people can take on tough issues more readily when the issues are presented with a spirit of hope. I want to ensure that I am instilling hope in my clients. Building a team around myself is one of the most effective ways to creating an institution of community change around diversity issues. So I would ensure that I get a good, strong mentor to help me and guide me as I continue to grow in becoming a great and successful marriage and family therapist. And last, I would say recognize and work with diversity already present in what appear to be homogeneous groups, meaning don't try to reinvent the wheel or work too soon into an area that I'm not competent in. In working to combat racism and other forms of oppression, many people become discouraged when they are unable to create a diverse group. Starting by recognizing differences in religion, sexual orientation, socioeconomics, parenting, and class backgrounds will help create a climate that welcomes differences. It will also lay the groundwork for becoming more inclusive. And as I wrap up, I just want to say that ensuring that I am sensitive to the diversities that transpire in our society and our world, which is ever changing, I would hope that I will not make anyone feel like they are not unique or they are not special just simply because of their differences. My objective is to ensure that I embrace the differences of everyone and that we work through those diversity issues together. Thank you.